To get the maximum health benefits of millets, a diabetic patient has to look into the quantities of the millets and the form in which they are consuming. Now, many of us know that millets are good. Millets are natural sources, ancient grains. They are bound to be rich in fiber and micronutrients like B complex, which might be deficient in processed foods like polished rice or semolina or breads. If a diabetic person wants to control the blood sugar, a careful evaluation of the portion sizes of the millets is very important, and in the form in which they are consumed has to be looked into. If we end up using a very fine flour of this millets, we may not be able to really control our blood sugar. Or when we are thoroughly pressure cooking them, breaking all the cells and into simple form, again the blood sugars may not be corrected. So, to get the maximum benefit of this low glycemic index, low glycemic load also has to be looked into. Most of the time it is better to consume the millets in their natural form or maximum in the form of some grainy structures or in the form of grits instead of flour. And to ensure proper glycemic load, it is better not to consume heavy calorie, heavy gravies along with the millets. Appropriate amount of proportion size have to be looked into to suit individuals' body mass index and their physical activity level in diabetics, so that they can get full benefit of consumption of millets for blood sugar control, and also matching with appropriate quantum of the dal has to be looked into to maintain the carbohydrate load in each meal. It is always preferred to consume millets with which at least in the ratio of 3:1 pulses with whole legumes, combined with only vegetables or green leafy vegetables or low fat curd to maintain the glycemic load of the product they are consuming. It is better to mix ragi with black gram urad dal to make a dosa, so that the glycemic index and the load is also not disturbed. The end use have to be kept in mind when we really shift from rice based diet to the millet based diet. Sprouted ragi porridge may not work for the diabetic patient. Instead, if you want to eat in a sprout form, it is better to eat in a natural form. Either roasted or puffed form are always better. Too much of fermentation, too much of processing of the millets may not be helpful for diabetic patients to control their blood sugars with millet based diet. Each millet, the combinations will be totally different. So, we should be aware of the millet's natural name and the glycemic index and the nutritive value before we expect good changes for consumption of the same. Too much of processing of the millets in terms of vermicelli or idli or in terms of porridge may not go very well for blood sugar control in diabetic patients. Each millet has a different glycemic index. Some millets like ragi may have high glycemic index, but because they have good amount of fiber, their overall glycemic load in a particular item will be always in a moderate range, and that can be used very cleverly manipulated to control the blood sugars in the diabetic patients.